that when you see MRI scan and you see compression by osteophytes, you need surgery. But I can say this with great conviction and on the basis of my 35 years of neurosurgery experience, that this concept is absolutely not correct. And I can say for sure that if you do MRI scanning of every person, every human being after the age of 50 or after the age of 40, you will see compression by osteophytes in 100% of patients. That does not mean that 100% of patients need operation. I can say with great conviction that patients presenting with neck pain and back pain and scans showing compression need surgery in absolutely a small minority of cases. On the basis of our evaluation, we have come to a conclusion that spinal degeneration starts not from the disc. It starts because you have not used your muscles of the back and of the nape of spine, here, nape of the neck, properly. So misuse of the muscles, disuse or abuse of the muscles, if you have not exercised properly, if you have not kept yourself fit, these muscles become weak. And because these muscles become weak, there is instability of the spine. Instability of the spine is manifested at the facet joint of the spine. The facets, which are like in an oblique fashion, these facets become unstable. They become weak because human being has a standing human position, and this standing human position, constant pressure of work on these muscles over the lifetime leads to weakness of these muscles, and there is vertical instability of the which is manifested at the facets. Essentially what happens is the spine becomes compressed or vertically small. So our concept is, one is, if you are having neck pain, you try to get over that neck pain with some drugs or some exercise or physiotherapy. After the pain has gone, do extensive physiotherapy and try to solve that neck pain issue. And then what you do is extensive exercise and strengthen your muscles of the back and neck, and this will lead to cure from that instability factor. The other issue is imaging and compression on MRI is no criteria for surgery. Instability is the issue, and when the pain is too much, or if you have symptoms in the hands like tingling numbness, paresthesia or pain in the hands, or paresthesia related to backache, or pain radiating to the legs, if this is the only issue, you can get over it by resting for some days, and then when the pain is gone, do extensive exercise and strengthen your muscles. However, in cases where the pain is associated with tingling paresthesia in the hands and weakness of the legs and difficulty in walking, difficulty in holding objects and weakness of the hands, then of course you need treatment and you need surgery. And in this situation you need surgery not by removal of the disc, not by removal of the bones, not by removal of the osteophytes, not by decompression, which according to my concept is absolutely a wrong operation. You need surgery by multi-segmental stabilization of your spine, whether it is neck or whether it is back. As we mature further into our understanding of the neck and back, we realize that on several situations, it is not only the problem in the neck, but also in the high craniocervical junction, which is the atlantoaxial joint, which can be a major point of issue in the entire cervical spine. So if you have hand pain and neck pain, it may be your atlantoaxial joint which is the problem and which needs treatment. So atlantoaxial stabilization and multi-segmental spinal stabilization, whether it is cervical, whether it is lumbar, is the bottom line of treatment, and which can be done and which should be done. Any removal of bone, laminectomy, decompressive laminectomy, corpectomy from front, introduction of spacers, implants from the front, according to me, are absolutely redundant and wrong operations. Multi-segmental fixation is the treatment, and in selected cases, atlantoaxial fixation should be included in your fixation construct. So this forms the treatment of spinal degeneration. Spinal degeneration does not begin in the disc, it begins in the muscles, and it is the bottom line of these cases is spinal instability. I would like to go one step further in the understanding of OPLL, or ossified posterior longitudinal ligament issue, which is also a common problem particularly in Asian countries. In this situation, in the situation of ossified posterior longitudinal ligament, the problem is also of instability and needs multi-segmental instability that includes atlantoaxial joint stabilization, and that forms the treatment of OPLL. Any form of decompression by removal of bone either from front or behind, according to my understanding, is a counterproductive operation.